Serotonin Syndrome. Exactly what is that? Well, it's in the word, serotonin. Too much serotonin. So when you have too much serotonin, you have the syndrome, and it's a serious syndrome, and it can be very dangerous. It is very dangerous. It's rare, though. It's like 0.01% of people actually taking SSRIs or drugs which are known to cause serotonergic syndrome, serotonin syndrome. Now, I've seen it. I've had 3 cases, and this is my 40th year. So what happens? This thing, when you start someone on a serotonin drug, it happens within an hour to 24 hours. It's fast. It's rock and roll. This comes on, and it hits, and you got a problem, and you have to deal with it. So it's either when you start a drug that has serotonin effects, usually increasing serotonin, or you increase the dose of a drug. Common ones, selective serotonin reuptake inhibitors. What they do is they prevent the reuptake of serotonin, so there's more available. What are the signs? Well, the first one, people get restless. They get a little tremor, diarrhea. You know, it's the kind of diarrhea where I remember I was on a kids unit. I work mostly with kids. The diarrhea was like squirting out. And I was holding them in the bathroom, and I'm like, oh my God. And I kind of figured out what was going on. I didn't realize it was that bad. Remember Linda Blair on The Exorcist, where the stuff was coming out of her mouth and her head was spinning? It's kind of like that. That's the feeling I get. And then people become really annoying, agitated, aggressive, and just impossible to deal with. It's scary how they almost become like another creature. They're not even, they just become totally inappropriate. They're getting agitated, nervous over nothing. They get a fever that comes on quickly, and it's above 102.2. So that's a high fever. Now, I would say the big one is the confusion, the change in personality, the agitation, the diarrhea. They get this fever, and they get like a little tremor, and they just start sweating. Like, it's dripping sweat. It's like, it's not perspiring, it's sweating. It's like little, teardrops are all over their face, and you're like, oh my God, what's going on? It's that kind of sweating. It's not like someone's like, oh, I'm perspiring, and they wipe their brow. No, it's like water is all over them. The big thing, they get hyperreflexia, almost clonus. I'll define it like you go back and they clonus, or you hit their knee and it just starts doing like this. Rhythmical, rapid movements. That's a big feature here. So you get them, and they're acting funny. They got serious diarrhea. They get confused. They get the fever. And this is rare. And then, okay, those are the main things. And then their heart rate goes up. Their blood pressure goes up. They get this clonus, this exaggerated reflex thing. It can go bad. I mean, I'm not trying to scare anyone, and I'm definitely making this for certain patients that are watching this. I'm not trying to scare anyone, but you can get to a state where you may have a seizure. You may have it where your muscles get so tight that they start breaking down, and it's something called rhabdomyolysis, where all the protein starts entering the bloodstream, and the kidneys shut down because they get all clogged up. Some of them complain of serious abdominal pain. I worked emergency room in New York City at Roosevelt Hospital, Harlem Hospital, St. Luke's Hospital, Coney Island Hospital, and I've seen a bunch of cases. And they come in, and they're acting weird. And so what goes through my mind is, okay, this could be an overdose of like dextromethorphan or chlorpheniramine, an antihistamine, or meningitis, or some kind of drug withdrawal, but you can narrow it down by history. Are they on some kind of drug? And so I ask them, the big drugs are monoamine oxidase inhibitors. What does that do? It inhibits monoamine drugs. Serotonin is a monoamine. Drugs in this class, tranylcypromine, phenelzine, isocarboxazide, they're old. They're dangerous because they have dangerous interactions and they cause this serotonin syndrome, and they cause a hypertensive crisis. Meclobamide is the newest one on the block, but they're dangerous because they prevent the body from breaking down serotonin so it can accumulate in excess and cause this serotonin syndrome, which is really bad. And obviously drugs like selective serotonin reuptake inhibitors like fluoxetine, Prozac, or Paxil, or Zoloft, or Trintellix, or fluvoxamine, which is Luvox, Lexapro, Celexa, all those selective serotonin reuptake inhibitors, they can cause this. It's obvious. And there are some ones that are selective serotonin norepinephrine reuptake inhibitors. Duloxetine, which is Cymbalta, Effexor, which is venlafaxine, Pristiq, which is desvenlafaxine, what is Fetsima, is levomilnacipram, and Savella is milnacipram. There are these dual action drugs, they can do it. The most common drugs to cause selective serotonin syndrome are the monoamine oxidase inhibitors. But obviously the SSRIs, the SSNRIs, and tricyclics like amitriptyline, imipramine, diazepamine, nortriptyline can cause it. Those are tricyclics. Believe it or not, there are anti-infection drugs. Isoniazid or Lenez-Zyvox. How do you say the name? Lenezolid and isoniazid. That's a tuberculin drug. It's for tuberculosis. It's not used anymore, but the Zyvox, Lenezolid, is some of the painkillers. Big ones, meperidine, tramadol, methadone, fentanyl. Fentanyl is so short-acting, it's rare. But the meperidine and the methadone, I've seen it. And as when I was a resident, there was a case, Libby Zine in New York, and she was on, I think it was a monoamine oxidase inhibitor. They gave her meperidine for pain, and it caused this hypertensive crisis, the serotonin syndrome. So this does happen. And I saw that little kid in the emergency room. I've had a few patients over the years. I don't want to alarm anyone and say, what happened or anything, but, sometimes it doesn't go well. There's an antihistamine, chlorpheniramine, can cause this serotonin syndrome. Dextromethorphan, I've seen that one cause it. That's common. It's called triple C's, Coricidin. People take a bunch of that. It's trouble. Those over-the-counter drugs are not so safe. And then there's some street drugs. Cocaine, ecstasy cause serotonin syndrome. Ecstasy, I guess that's MDMA, and Molly, St. John's wort, SAMI, 5-HTP, kava, with ginseng. Weightlifters get into all this crap. They take amphetamines to lift more, or they're taking painkillers so they can lift more, and they're taking all sorts of natural kava and all this crap. They get into trouble. Diet pills, phentermine, the weightlifters are doing that. Those are the main ones. There are other drugs which affect serotonin because of the unique way where they act on the receptor. It's usually postsynaptic accentuation or stimulation. They do not cause an interaction, and it's unlikely, and you can use them. So I always get calls from the pharmacist. You have a drug interaction, Dr. Agresti. You're mixing your Zoloft or Prozac with one of these drugs, and it's like trazodone, mirtazapine, Buspar, lithium. No, those don't have interactions. It's safe. The triptans, all the headache migraine pills, sumatriptan, frovatriptan, Emerge, Maxalt, Zomig, Frova, all those drugs, they're safe with these SSRIs. Lithium, ritonavir, amitriptyline, or amphetamines. So the pharmacist, it'll cause an alert in their computer system, and I just tell them, no, it's okay. Those are highly unlikely to cause an interaction and cause the serotonin syndrome. So it's okay to take those. So if you're on those two, you're safe. Now, what do you do with the treatment? Well, the big one is you stop the serotonin drug. You push IV fluids, because think about it. They're sweating, they have diarrhea, and not only that, they've got abdominal pain, nausea, and they're vomiting. So it is serious that you start IV fluids and push it. There is a drug which, cyproheptadine, stops the syndrome, or it decreases serotonin activity. Cyproheptadine, periactin. You give 12 milligrams, then 2 milligrams every hour. You have to give it PO, but so and then what else you do? Because they're so agitated and their muscles are so tight and they're just over exertion of their muscles, they're breaking the muscle down. You can give Valium, IV Valium, just to calm them down, stop the tension in the muscle, the agitation, the aggression, the confusion, and just to sort of sedate them. It's critical. You run. I push a lot. So I worked emergency room all those years, like 20 years. So I would run the IV Valium, 40 milligrams, 50 milligrams in like 12 hours. I just let it rock and roll. I push the periactin, and I push the fluids. Sometimes they're so agitated. I give them that propofol stuff. It's like a white, milky stuff. We get an IV going, and just that'll just settle them down. And they come out of it. Hopefully you don't get a seizure or kidney failure or some serious consequence. I don't want to scare anyone. This is very rare. Just about everyone I had with this, I got out of it. And the key thing is to catch it before it gets carried away. But just remember, 0.01% of people get it. So it's very rare. And remember, this illness is a matter of degree. So if you get all these side effects from these drugs, the Prozac, Paxil, Zoloft, Lulox, Lexapro, Celexa, Pristiq, Effexor, Savella, Fetsima, did I name them all? Cymbalta. All those drugs can cause these side effects of confusion, nausea, diarrhea, abdominal pain, headache, fever, increased heart rate, blood pressure. So they can all cause it. Increased reflexes, mild fever. So they can, but this is like a degree. When you get the syndrome, it's too much serotonin. Yeah, we know we're increasing it with the drugs. We know that, and the body adapts within usually a week. But if this continues and it gets severe and the symptoms become extreme, it happens quickly, within 1 hour to 24, we got a problem. So that's the gist on serotonin syndrome. I appreciate a like, a subscribe, and I do have my book for sale on Amazon.com, Tales from the Couch. Hey, listen, some comments would be nice. Bye.